Summer is right around the corner, which means many of us are dusting off our shorts and bathing suits. But if you're not quite ready to show your legs to the world yet, cosmetic surgeon Dr. Cameron Rokhsar is here to tell us all about some procedures that can glam up your gams in no time. Dr. Rokhsar, great to see you. How are you?
Good morning, Tanya. How are you?
Let's start with veins. Let's get right to it, because so many women and men have these unsightly veins that prevent them, even if their legs are in great shape, that prevent them from really bearing all in the summer. Are there some really good new procedures that deal with the unsightly veins?
Yes, Tanya. You know, leg veins, like you said, happens to be a very, very common problem, and a lot of people aren't aware that there's really good solutions right now for treatment of leg veins. There's a new drug that actually recently got approved by the name of Sclerotherapy, which has been available in Europe for many years. The generic name is polydoconal. And we actually inject this drug into the veins, and it irritates the lining of the blood vessels, and it causes the blood vessels to collapse. Usually it takes a series of injections to do this, and the results are quite good. There's also other options available, again, depending on how big the veins are.
Now, is that, the procedure you just described, is that more useful for spider veins or varicose veins?
That's more useful for spider veins and what we call also reticular veins, which is the blue-green veins.
Ah, okay, the ones that protrude a little bit?
A little protrude a little bit. Now,
okay.
They're not quite varicosities,
Okay.
like big varicose veins.
What do you do to treat those varicose veins?
If you have really big varicose veins, you actually have to look at to see why that is. And a lot of people actually have what we call valvular insufficiency, meaning that we have actually valves in our veins, and these valves prevent the backflow of blood from the deep veins to the superficial veins. So if those valves are leaky or they're floppy, what we call, there's backflow, and that's where you get varicosity. So you need to identify where this insufficiency is. You can actually go in with a laser inside the vein and apply some laser energy to actually collapse the vein.
Interesting. Now, because sometimes people get varicose veins, not just on their legs, but sort of all over their body. Is that a similar...
It's similar again, but those type of things need to be investigated
Right.
to see exactly what the issue is in terms of the valvular insufficiency. Now,
Right.
there's also very, very fine blood vessels that sometimes appear on the legs also. We call those telangiectatic matting. And those can actually be treated with lasers, also with superficial lasers on the surface. So
Right.
there's quite different options available, but in my opinion, sclerotherapy, that's injection with a sclerosing solution like polydoconal Sclera, is probably the best solution for spider veins as well as reticular veins.
And how much do these treatments cost, and how often do you need to go back and do them?
The treatments are actually rather inexpensive. A typical session will cost something on the order of $500, and you may need a few sessions of that. You know, anywhere from 2 to 4 sessions, spaced something 4 to 6 weeks apart.
Is it better to do it in the fall and winter?
The really important thing about treatment of leg veins is not to immediately go in the sun, because you can run into pigmentary problems. So it's important that you practice sun protection. You know, you're going to wear your sunblock pretty regularly, or stay away from the sun immediately after an injection.
Now, is anyone a candidate for these procedures, and are they painful?
Anybody is a candidate for these procedures as long as the issue is uncomplicated. Like I said, if there is valvular issues, those need to be addressed first.
Right.
So you need to see a physician, you know, a dermatologist or a plastic surgeon who's well versed in treatment of leg veins.
Right. Are they painful?
You know, it's funny you ask that. Before polydoconal or Sclera, we used to use hypertonic saline. That's a very salty solution that actually burns. So a lot of people who've had treatment of their leg veins will say, you know, oh my God, that's really painful and it burns. But with the sclerosing solution, like Sclera, it's actually not really painful at all.
Fantastic.
It's much more comfortable.
Keeps getting better and better, right? Now let's talk a little bit about cellulite. You know, it is something that plagues many people, but we've heard before there's just really not much you can do. Is that still the case?
There is some newer options available. Cellulite is one of those things that we still, as a medical community, don't really have a good understanding of. You know, cellulite is one of these things that's probably genetic to a certain degree. It's probably hormonal to a certain degree also, as it's more common in women. It probably has to do with the way the fat lobules interconnect with the surface of the skin. They're fibrous septa that actually, you know, kind of connect these things, and it kind of gives the irregular surface appearance. The options right now available, there's two. One treatment by name of VeloShape and the other one by name of Thermage. Both use a form of energy called radio frequency to heat up these fibrous septa and fat lobules to cause remodeling of the cellulite.
Are they effective?
They are effective for temporary improvement of cellulite. So we have no permanent solution, but with treatments, they can be temporarily improved.
How much are these treatments?
Usually, you know, they cost in the order of a few $100s to potentially
All right,
$1,000
so
or $2,000.
if you have a big
depending on
event
the
and you're going to
extent.
wear a short skirt, maybe it's worth it doing,
It is worth
right?
it. You know, the Vela shape is usually a series of treatments.
Right.
You know, you do it like once a week for 6 weeks, and you know, you can get improvement for 6 months to a year.
Right. And let's talk about sort of the laser lipo, the sort of the small adjustments that you can make nowadays that can make a big difference.
Yeah, laser liposuction is basically a procedure where we're inserting a tiny laser cannula underneath the skin to kind of remodel the fat, to melt the fat. So it's, you know, it's become a minimally invasive procedure that's done under local anesthesia. It takes, you know, an hour to two to do, and you basically go about your business. So it's really transformed liposuction into a minimally invasive, manageable procedure that can be done as an outpatient.
So let's say you don't like your thighs. Can you go into your office or someone's office and get this laser lipo done in the afternoon and come out with model thin thighs?
Yeah, but you know, it has a few days downtime. You know,
Okay.
you still gotta, you know, take a couple of 2 or 3 days off. But yeah, you can actually have great improvements. You know, the common areas in the legs that people have problems with are outer thighs. We call them saddlebags. People have problems with their inner thighs and sometimes inner knees. Those are the most common areas where we have collections of deposits of fat that are unresponsive diet and exercise, and those patients are good candidates for this procedure.
And you've had good results with that.
Very good results. We usually do combine lasers with a little bit of traditional liposuction.
Okay.
We do, you know, suck the melted fat out, and that gives definitely better results.
And how much is the laser lipo?
It's on the order of a few $1,000s, you know,
Okay.
depending on the extent of the liposuction that you do.
A little bit more. And quickly, finally, let's top it off with laser hair removal. That's very popular these days. Have there been lots of improvements in that field?
You know, laser hair removal happens to be, in my opinion, the most permanent way to cause decrease in hair density, as well as actually the least painful. It usually requires a few sessions with the right laser, anywhere from 3 to 6 sessions, to cause semi-permanent results. By semi-permanent, what I mean is that you do get drastic reduction, but there are people who need touch-ups here and there from time to time.
All right, Dr. Rokhsar, thank you so much. This is fascinating. We can have glamorous gams after doing all of these things. And for more health information that's good to know, please check us out on the health page at abcnews.com.